All right, thanks everyone. So it's 2:03 and I think we can go ahead and get started. So I'm Corey Hallett, I'm a program director with the NCI SBIR program, and I'm here with my colleague Monique Pond, and we're going to talk today about the Small Business Transition Grant. I'll probably talk through the slides. I have about 30 slides, so I'll probably talk through them. I want to give plenty of time for Q&A. So I may move through them somewhat quickly. I'll try to keep an eye on the chat. So if you see me looking over here, this is where the chat is. I'll try to keep an eye on the chat. And if we're getting a lot of questions, I'll try to go a little faster. So please feel free to use the chat. So a couple housekeeping items that I just want to make you all aware of before we move on. So this is being recorded. It'll be posted to our website after the talk is over, probably a couple days. So if you need to go back and reference it, you can go to NCI SBIR or SBIR@cancer.gov. I think I said that right. So the slides, after the end of the webinar, we will email out the slides to all the registered attendees. Please make sure you're muted, but we will mute you anyway, so you shouldn't have to worry too much about it. And then if you have questions, please put them in the Q&A box, and I will answer them after the end of the presentation. I think I only have the chat open over here, so I might not be able to monitor as you're adding them. So now I can. I just moved it. All right. So let me give you an outline. I'm going to briefly talk about the SBIR and STTR programs just in case there are people here who are new to the programs as a whole, so that will give you a little bit of context, because the Small Business Transition Grant that I'll move into next, it is a specific funding announcement that is it within the SBIR and STTR program. So I think understanding those programs will be important. I'll talk specifically about the Small Business Transition Grant and some of the specifics related to that grant. So this really is a grant that's meant to help facilitate people as they transition out of an academic setting and into a business setting. And I'll obviously talk about details there. I'll briefly mention other resources and best practices, because I think that's really important when thinking about applying to the SBIR program. And then Monique and I will be available for Q&A. So as just briefly, the SBIR and STTR programs, they are congressionally mandated programs. So NIH is not the only agency that has an SBIR program. There's actually 11 federal agencies. NIH is part of the Department of Health and Human Services. And so the SBIR program for the Department of Health and Human Services does cover more departments than NIH, but predominantly it's NIH in the SBIR program in HHS. DOD is the largest. They have, I haven't kept track this year, but their SBIR program has generally been several $1 million more than ours. At NIH, our SBIR program is just over $1 billion. So DOD is quite a bit of money through their SBIR program also. They administer theirs a little bit differently, but it's definitely an interesting program. At NIH, there's 27 different institutes and centers. What that means is that there are 23 different SBIR programs. There's 4 centers that don't have funding authority, and so therefore they don't have the ability to send money outside of the federal government, and they can't administer grants, and so they don't have an SBIR program. But all of the institutes that administer grants, they're all focused around specific disease areas. They all have an SBIR program. I think what's really important and relevant for today is that the Small Business Transition Grant, there are 3 institutes that participate in this. So anyone who's applying for a Small Business Transition Grant, their technology needs to apply to either the National Cancer Institute, the National Institute on Drug Abuse, or the National Institute of Biomedical Imaging and Bioengineering. The SBIR and STTR programs, they are a set-aside program. So what that means is that each of those institutes needs to set aside a certain amount of money for small businesses to engage in R&D. And we do this both through grants and contracts. I'm not going to talk about contract today because the Small Business Transition Grant is a grant, but I will just mention that there are also R&D contract opportunities for small businesses through the SBIR program. The SBIR program is a set aside of 3.2% of the NIH's budget. This is separated by institute. So the NCI sets aside 3.2% of its budget to fund through the SBIR program. So that in fiscal year 22 was about $159 million. The sister program, the STTR program, and I'll go into the differences a little bit later. This is a smaller set aside, is 0.45% of the budget. So at NCI, it's $22 million. I don't have the NIDIB or NIDA figures in this talk, how big their SBIR programs are. But for the Small Business Transition Grant, because this is an RFA, that's the type of funding announcement it is, each of those institutes has set aside a specific amount of money to fund a specific number of awards. And that you can find that information on the FOA. In total, at NIH, the SBIR program is SBIR and STTR together is about $1.2 billion that will be awarded through to small businesses in fiscal year 22. So the goals, this Congress, when they set up this program, they set 4 main goals. One is to stimulate technological innovation, so that's help keep America at the technological forefront. The second is to meet federal R&D needs. The third is to increase private sector commercialization of innovation that's developed through federal R&D, so that could be through grants or maybe intramural things happening at NIH. Because this really is an economic stimulus program in addition to being a technology development program. And finally, foster and encourage participation in innovation and in entrepreneurship by women and socially and economically disadvantaged persons. That's not my language, that's a language just in the legislation. So to be eligible for the small business, the SBIR program, only small businesses are eligible to apply. So when a university faculty member applies for an R01, that generally comes from the university. They aren't eligible, universities are not eligible to apply for the SBIR program. It has to be a for-profit small business that's operating in the United States and is owned by the United States. So if a university faculty member has a small business or some sort of university affiliated scientist has a small business, they've spun it out of the university, that small business entity is what would apply for SBIR or STTR funding. As I mentioned, it has to be for profit. The federal definition of small is 500 or fewer employees. That's a federal-wide definition. At the NCI, most of the businesses that we are funding are really early, so it's maybe a handful of people. It would be really rare for us to fund some companies that have 100 or more employees. I'm not going to say it's never happened. We're often funding companies that are 1 to 10 people, somewhere in that range. The company also has to be U.S. owned and operated. So more than 50% of the ownership has to be held by either U.S. citizens or U.S. Permanent residents. The small business can be owned by another business as long as that meets the U.S. owned and operated criteria. And then small businesses that have venture capital funding and their majority ownership is a venture capital or private equity firm or something along those lines, they are eligible to apply only for the SBIR program, not the STTR program. And there's a few caveats there. I'm not going to go into that because really no one who has that makeup would be eligible to apply for the Small Business Transition Grant. But if you're on this webinar and that applies to you, I would encourage you to reach out to a program director and talk more. Why do small businesses seek funding? Probably the biggest reason is the second thing listed on this slide, which is that the intellectual property rights are retained by the small business. The other reason is that it's non-dilutive. It's not, I think this slide changed a little bit, so I don't see exactly where, I guess it's point number 1. So when you get private funding from a venture capital firm or something like that, they own a piece of your company, right? The SBIR program, these are grants. Even for the contracts, you know, they're not loans, and the government does not take a piece of your company. So that's what it means by non-dilutive. You still own all of your company when you receive an SBIR grant. It does provide recognition and validation of the technology. It's gone through peer review, and that can be leveraged as people are out talking to fundraisers and other things, their technology gets further advanced. It helps, we've heard from the community, it helps to have received SBIR funding because it's gone through peer review and scored relatively well by a panel of scientists. And it can help provide additional support. Oftentimes it's companies leveraging the fact that they've received SBIR funding in their fundraising activities. That's oftentimes how it helps attract additional support. So there are many paths to entrepreneurship, and in our portfolio, we see people come to entrepreneurship from students, postdocs, early faculty, and tenured faculty. All of these paths can lead to entrepreneurship at any time. But we did a portfolio analysis where we talked to a lot of cancer centers or cancer center serving institutions, and we talked to about 70 of them. And what we heard was that we're seeing more postdocs moving with a technology to a small business, and that there's a real need for scientists with more business expertise. Oops, excuse me. But when we look at our data at NIH, what we see is that more often than not, experienced NIH investigators, so investigators that have received an R01, at least one R01 already, tend to be a little bit more successful in receiving SBIR funding. But we know that's not the direction that entrepreneurship is going. And so that was sort of the background to the Small Business Transition Grant. We know that more early scientists are moving into entrepreneurship, and we wanted a mechanism to help people make that transition. So I'll talk a little bit about small business funding for early career scientists, or the Small Business Transition Grant. It is modeled after the K99R00. When we look at the path to tenured faculty and we look at the path to entrepreneur, even though you can make that leap to entrepreneur from anywhere, we didn't see any assistance grants to help postdocs make that leap. And if they're thinking about moving to entrepreneurship, we thought it would be really helpful to have one of these interim transitional grants. And so we developed the Small Business Transition Grant. And the most recent RFA is CA22017. So you can pull that up, you can Google it, and it will be the top hit. The SBIR program as a whole is a 3-phase program. Phase 1 at NCI is up to $400,000. And if you're taking notes on this and you're taking notes on the budget and you're applying to NIDA or NIBIB, I encourage you to pull up that RFA. There are 2 tables, like kind of at the top. The second table will have budget information. So take a look at the budget information for NIBIB and NIDA, because right now I'm sharing NCI specific budget information. And you may need to reach out to the points of contact for NIDA and NIBIB. And you can find that information if you scroll all the way to the bottom of the funding announcement. There's technical or scientific points of contact, and feel free to email those people. So phase 1 is up to $400,000. It's about 6 to 12 months of work, although we've extended that a little bit in the Small Business Transition Grant. Phase 2 is generally more continued R&D, moving more toward the development and maybe away from the early research. And that's up to $2 million over 2 years. There is some follow-on award funding called an Phase 2B Bridge at NCI, and several institutes have a Phase 2B program. I'm not going to talk about that because that's later stage funding, but just know that following a Phase 2, there are other opportunities. And finally, there is in the law, there is something called a Phase 3. At NIH, they say that's use of non-SBIR STTR funds, which means you're on your own, which means it's not actually part of the program. There are DOD, NASA, I think there are a couple federal agencies that have a Phase 3 where the government actually acquires the technology. So DOD, for example, you build something for a fighter jet, they'll start buying it. But at NIH, our program's not structured that way. Same with NASA, right? You build something for a spaceship, they'll buy it for you, from you sometimes. But you know, that part of the program doesn't exist at NIH. There is something called a fast track, which is a combined phase 1 and phase 2, and that's how the Small Business Transition Grant is built. And so in these proposals will have, they'll follow the page limits of a phase 2. So these are longer applications, but they need to have a phase 1 component and a phase 2 component. And there's a few specific things about the Small Business Transition Grant that differs from a traditional fast track. First, I want to talk just about the SBIR and STTR programs, because the Small Business Transition Grant is a hybrid of these two things. So the SBIR program, this allows, you can work with a research institution under the SBIR program, but it's not required. There are limits on how much money can go to the university. I'm just going to say university because it's a not-for-profit research institution. So there are limits on how much can go to the university. The Small Business Transition Grant uses an SBIR in phase 2. So this would be the 50% limit. Not more than 50% of the money can go to a university in the phase 2 SBIR. Also, the PI's primary employment must be with the small business. So what you'll see in the Small Business Transition Grant is that it's a phase 1 STTR. The PI can stay at the university, and then it flips to a phase 2 SBIR. And so anyone who's applying for this should be ready to move out of the university and into the small business setting. And that's because there's this requirement in SBIR that the PI move their employment, their majority employer, so 50% or more of their employment status must be held by the small business. An STTR is it's a partnership between a university and a small business. The award still goes to the small business, but it requires some university involvement. It's a minimum of 30% of the work must go to the university in phase 1. Also, the PI's employment is not stipulated. This doesn't mean, and this has actually come up in the past, this doesn't mean that someone can work for a third party and apply for a small business transition grant, because under the STTR, the PI needs to be employed either by the university or by the small business. I'll cover that again. So if you didn't get it all, it'll come up again. This is how the Small Business Transition Grant is structured. The phase 1, as I mentioned, is an STTR. The ideal PI here is a postdoc. So this is a person who's not more than 8 years from their terminal degree. It can be a graduate student. So if there's graduate students on here that are thinking about this, graduate students aren't prevented. We just have, we think there's more postdocs that are ready for this out there. We've seen more postdocs that are ready for this. The graduate students get a little bit more tricky because of the way this is structured, and I'll talk about that a little bit on the next slide. A mentoring plan is required, so there needs to be 2 people that are mentored, or 2 people that are mentors to the PI. One is a technical mentor, so this is probably the lab head of the academic lab. I'm not going to use PI for that term because it gets really confusing with the PI of the Small Business Transition Grant. I'm going to say academic lab head. So this is the lab head of the academic lab. It can be someone else, but preferably it's the academic lab head. A second is a business development mentor. And the role of this person is to really help the PI understand what are the right commercial milestones I should be reaching for with all of my assays and experiments in my development plan. The technical mentor or the academic lab head, they should be able to help the PI determine how to address those things, right? What are the right assays, techniques, and models to address those questions? But the business development mentor, we want to see a nice, clean development path for these technologies, and we want to see the business development mentor helping with that. During phase 1, the PI can be at the university or the small business. It doesn't matter which place. But the technology needs to be preparing to move to the small business. So most of the work could happen at the university in this phase, and then that'll switch to at least half the work needs to happen at the small business in the phase 2. Also, NIH is required, or I-Corps is required. I-Corps is an entrepreneurial training program, and it will be required for transition to phase 2. So during transition, Technical milestones will be evaluated. The PI, having moved their employment to the small business, will be evaluated. We also want to see that the university continues to support the whatever sort of license or license option or whatever sort of IP agreement there is with the university. We want to see the university continues to support that. After transition to phase 2, training should continue of this PI. It's the same PI, it's not transferable. So it has to be the same PI from phase 1. And the mentoring needs to continue with the technical mentor and the business mentor. Most of the research we hope will be conducted at the small business. We really do want to see the technologies moving out and the small businesses being formed. Small pivots are allowed. We don't want to see major pivots in the, as you move out to the small business. So as I mentioned, the eligibility is maximum of 8 years from terminal degree. Take a look at the RFA because there are exceptions for this. We understand that there are reasons people leave the workforce for a small amount of time. So when we say 8 years from terminal degree, that's 8 years of bench work. Maybe someone left for childcare or elder care or, care of a loved one, or there's tons of reasons people would leave the workforce for a period of time, and that would stop the clock for that period of time. So take a look at the RFA because the 8 years that's not a hard cutoff. We are especially encouraging women and scientists from underrepresented backgrounds. Their NIH has information on who the underrepresented backgrounds are as it relates to the biomedical sciences. And so that's what we would consider. There's not a special review, but we are especially interested in seeing support for women and underrepresented scientists move to entrepreneurship. So we do have a special interest in these groups for this RFA. There is special review criteria because much like the K99 R00, this also has this personnel development and mentoring portion, and there is peer review criteria around the mentoring plan. So we say this is a dual purpose RFA. It's technology development and it's mentoring or like personnel development, and those kind of have equal weights. And because of that, the technology has to succeed. If you don't hit the technology development milestones, we won't transition this to phase 2, just as to support the development of the scientist into an entrepreneur. They have to have a technology that's working and moving forward. As I mentioned, I-Corps NIH is required in the phase 1. It's this is the current funding announcement. So this isn't what people would apply to, but I just put this up just for an idea of what that entails. So this is a entrepreneurial immersion course. You have classroom sessions. There has to be a 3-person team with decision making in the company, and they get out and they do 100 interviews over 8 weeks with people who are stakeholders in the company. So this could be prescribers of whatever the technology is. These could be payers. These could be customers, which may or may not be one of those groups, right? So it's just to get out and learn as much as you can about the value of your technology in the market, how it would be used, who would use it, who would pay for it. And it's a really good course. So we want to see people complete this in the phase 1 portion. I encourage you to reach out to a program director. This is all the NCI program directors. As I mentioned at the bottom of the Small Business Transition Grant RFA, there's information on the scientific contacts for NIDA and NIBIB. Our scientific contact for this RFA is Monique, who will be joining me for Q&A in a little bit. So other SBIR initiatives and resources, here's where I'm going to start moving somewhat fast because I'm trying to keep an eye. We only have a couple questions, so I encourage people to keep adding questions to the Q&A and so that we can answer them. All right, so at the NCI, there are several activities that the SBIR program does, and this is true at other institutes also, but NCI has a little bit different structure in that we are centralized. So as I showed the slide before, with all the NCI SBIR program directors, we are dedicated 100% to SBIR and STTR all the time. We manage a portfolio of SBIR grants. We give guidance to applicants, so always feel free to reach out to us and discuss your specific aims or your plan. Sorry. We manage the funding opportunities, so we release the funding opportunities, and then we have some other trainings for supports. We have a mentoring program that was recently launched, and we have other commercialization initiatives. Once a company is funded, to try to help their technology succeed and help the company succeed and move more toward commercial development. These are all of our assistance programs, and I just put this one slide up here because I don't want to go into detail on all of these. I just want to point out that they are there. There are 2 assistance programs before phase 1. So almost everything we offer doesn't start until you receive at least a phase 1 award. First, there's the applicant assistance program I'm going to talk about on the next slide, so I'm not going to mention it here. But the NCI plan webinars, we have a webinar series where we bring in previously successful grantees, and they'll talk about how they addressed a specific problem. So this is an open webinar series, I believe. And if you sign up for our notifications on our website, which is sbir.cancer.gov, then you, I think, will receive notice of these. The applicant assistance program it's only for phase 1 SBIR or STTR applications, not fast track. So you could not use this program for the small business transition grant. But if you or anyone you know is applying for an SBIR or STTR phase 1 and you have not received NIH SBIR funding before, you can apply for the applicant assistance program. It's a free program. It gives you access to someone who is an experienced grant writer. They will not write the grant for you, but what they'll do is give you a lot of feedback. So they'll give you a timeline on when things should be happening. They'll have regular check-in calls with you to make sure those things are happening, and then they'll review different parts of the application. So it really is preparation, support, and guidance and coaching, but they're not going to develop the grant for you, and they're not going to write the grant for you. There's also something called the Innovative Concept Award. There are white papers for this that are due in just a couple of days if you want to put something together. These are just, I think, 1 page, say on here, they might be up to 2 pages, but I think they're small, right? They're just a couple pages. It's like a pre-submission to the NCI to say, here's what I'm thinking. And you'll get feedback on, that basically says, yes, we think this aligns with the concept award, and then you can apply, or no, we don't think this aligns with the concept award. You can still apply. You just know ahead of time that we didn't think it was a great fit for the goals of the program. All proposals are due in August, and this is a contract, so it's a little bit different how it's structured, and we actually can't, as program officers, we can't answer questions about this or about your technology specifically. For a grant, you can send us your specific aims page and we'll hold a call and we'll give you advice and feedback because it goes through peer review, and the program officers have no influence over that peer review process. But the contracts and concept award, they fall under federal contracting rules, and so we can't give you that same advice. But the goal here with the concept award is to support high-risk, high-reward technologies in pediatric or rare cancers. And this is a $300,000 award for up to a year. No clinical trials are allowed. We really want to see high risk, high reward, and disruptive technologies for this. And so that's where the white paper can come in handy, just submitting it and asking if NCI thinks it's a good fit. The proposals do not require preliminary data, and we take that very seriously here. I know a lot of NIH applications and funding announcements say that the proposal that you're not required to have preliminary data, but here we really are looking for testing innovative ideas, and we're very, very insistent that the proposals do not require preliminary data. I think I just had 2 slides on this, so my apologies. So best practices. The first thing that I want to talk about is that the SBIR and STTR is product-focused science. And this sounds like a no-brainer, but it's actually really important. And it's kind of a nuanced difference from the traditionally academic grants like the R01s and the R21s. So in an academic grant, if you think about the review criteria and how it influences the science, right? You have the approach and the expertise in the team. This is all going into like this central thing that's science. And you want to make sure what you want out of that is you want to increase knowledge, you want publications, you want to show that there's new pathways, how things work, new targets, all this stuff is coming out that's really furthering the knowledge base of the scientific enterprise. And that's very important, but that is academic funding. For SBIR, the really important thing is that it's focused on the product. And it's not to say that this high quality science doesn't have a place in SBIR, it absolutely does. But the application itself should focus on the product. So when you think about the approach, is that the right approach for product development? I see a lot of immunotherapies. I have several people who are academic spin-out have the same studies I did every week in grad school, which is remove the tumor, grind it up, and look to see what immune cell infiltrates are in there. But that very rarely has a place in product development, because if you see a lot of CD4 T cells, maybe you see a lot of Tregs, is that going to be critical to your development path? You have to be those get really tricky on when and why you would use that for product development. Your team and your expertise needs to be appropriate for product development. The environment needs to be supporting a commercial enterprise and thinking about driving that commercial enterprise forward. Your significance needs to change a paradigm. It's a little easier with therapeutics, somewhat, because you kind of know how they're going to be used. But things like diagnostics, if you're developing a diagnostic, is it going to be used? You're going to put this diagnostic out there. Are people actually going to use the results of it? Because if a physician or a medical provider is not going to change their behavior, their recommendations, their patients based on the results of that test, then it's probably not going to make it in the marketplace. And so it's those sorts of things that you want to think about. Those need to go into your proposal for an SBIR and STTR, and those aren't usually part of an academic grant. And so just briefly, the NCI SBIR portfolio, I just want to throw this up there to say we are a technology agnostic institute. So what that means is we will fund anything as long as it has to do with cancer. That could be directly impacting or treating the cancer patient, or diagnostics. This could be helping the cancer caregivers and their teams. This could be research tools. It's all over the map. And here's where our portfolio falls, just based on what applications we see and what peer reviews competitively. Not surprisingly, we see a lot of therapeutics, a lot of diagnostics, and a lot of devices for cancer therapy. Imaging is also another, new imaging tools, software to make imaging clearer or more streamlined, right? Those makes up a lot of our portfolio. Cancer biology and cancer control. I mean, we see a lot of e-health too, and so that'll fall into those categories. We fund about 80% of our budget through grants, and then as I mentioned, we do have R&D contracts. Those are announced once a year, usually in the fall, and we're very specific and prescriptive on what we want to see there. So if you're a small business and you need the SBIR criteria, it's always worth looking at our contracts solicitation. We have a webinar coming up on contracts, and I don't know the date off the top of my head, but hopefully Monique or Bryce, who is supporting us, will put it in a chat and I'll see it and I'll tell you guys. We have about 475 active awards at any given time. So the program directors that I mentioned, which I'm going to put back up here because I want to really stress that you should reach out to us. But this group of people is managing about 475 awards to small businesses at any time. So we really are thinking about small business all the time and how to support small businesses. And when I say you should reach out to an SBIR program director, no matter the institute, That's part of our role in the program director role, is to be the liaison to the community and to the applicants and awardees. So always reach out to your program director. And finally, I'm gonna leave you with this one thing, which is prepare to resubmit. It's really frustrating, and likely when the very first time you submit, you'll get the peer review comments back and they will be frustrating, and you'll feel like the peer reviewers didn't understand, because this is more often than not, right? The applicant feels like the peer reviewers didn't understand the technology, they didn't understand the development plan. There was so much there that they didn't see, and peer reviewers are, it's not a perfect system, but it's the best system we have. So it is just part of the process that they will have comments, questions, they'll think about it a different way than you do. They'll put those in the summary statement, probably not thinking about your feelings when they're writing that down. So read it, walk away from it, come back, try to get at like the technical points that they're making, and then be prepared to revise your proposal and resubmit. That's just the process. So you can always talk to your program officer. When you receive a summary statement, your program officer's name and phone number and email will be at the top of that. And if you can't find them there, there's always a way to help you find your program officer, because as I mentioned, the program officers, this is our job, is to be a liaison to the community. So if you don't hear back from your program officer, follow up. There's just a lot of people that email them. So be persistent. We won't get mad. And with that, please put any remaining questions in the Q&A box. I think Monique is probably going to come on. I'm going to leave this thank you slide up, and then I'm going to try to find my WebEx video again, because I can't actually see anything except my presentation. So Monique.
Yes, thank you, Corey. Thanks for that presentation. And the slides will be sent out to everybody, so you'll have those available. So I wanted to touch on a couple kind of high-level questions about how to apply to SBIR in general that were asked. So in the chat, I put a link to what's called the HHS Omnibus Solicitation. And just keep in mind, this is actually 4 different links. When you go there, you'll notice. So depending on whether you're submitting just a regular SBIR or an STTR, or if you are including a clinical trial or not, that's how you'll take a look at each of those links and select the appropriate link. And the question asked about that was, will this go to any departments? And I think what's meant is, will this go to any institute? And so this, again, is the general HHS solicitation. So it could go to any of those 24 institutes that Corey showed at the beginning of the presentation. Keep in mind, though, if your question is really about for this particular small business transition grant FOA, that with the combined phase 1 STTR, phase 2 SBIR, currently that's 3 institutes that are participating in that FOA. And so it's NCI, NIDA, and NIBIB. So hopefully that that clears up that question. One other quick question I want to address. Again, this is not the Small Business Transition Grant Award that Corey spent most of the presentation discussing, but she also mentioned our phase 2B award. So that's after you successfully secured phase 2B fund or phase 2 funding, you can apply for what's called our bridge award. And so the answer, the question was, is it necessary to have third-party funding when you apply for that award? And the answer is, to be competitive, you should secure some outside funding. So from venture capitalists or some non-government grant funding, some investor funding. You don't have to have all 4 million matching funds at time of application, but certainly reach out to a program director, discuss the amount that you have raised, and we can talk you through kind of the logistics and details of the bridge award at that time. There was a question, I think, again, a general question about STTR that Corey touched on at the beginning of the presentation. So how much is the maximum work allowed for an institution for the university under an STTR grant? So if it's a phase 1 or phase 2 for STTR, you can have a subaward to a university of up to 60%. Yes, 60%. But keep in mind, if you're applying to this transition fast track, the first phase 1, that's an STTR, but for phase 2, that switches to an SBIR. So you would need to follow the SBIR rules at that point. And under SBIR for phase 2, you can have a subaward of up to 50%. So just keep in mind the switch that happens there.
Yeah. Can I add a little bit to that, Monique? So that's all correct. The STTR rules are statutory, so they're really not flexible. We don't have the authority to change the way the law is written. The SBIR rules are policy, and they're policy set at the NIH level. So we have a small amount of flexibility there, but not a lot.
Yeah. So I wanted to touch, there are several questions about the Small Business Transition Grant, the PI eligibility and the review. The first being, should the PI for the Small Business Transition Grant, is U.S. citizenship required? It is not, but the PI should be a permanent resident. Also asked about the PI eligibility was the scrutiny that peer review will use and how they will judge an early stage scientist. So there will be a special study section just for these grant applications. And so that study section is only reviewing applications from early stage scientists. And so it's a little bit more of an, apples to apples comparison that they're seeing. And, the study section is aware that the PI is required to be an early stage scientist. And so, certainly if you have publications, definitely include them. That will be looked at, but it won't be, because you're early stage, the number won't be as looked upon as much as, say, if you went through the regular SBIR ST process. Also, if you have participated in any sort of more entrepreneurial focused work, so whether that be training, maybe you did through your university as part, during your graduate years or postdoc. Some universities have different competitions, like a pitch competition for future products, and maybe you participated in that with your technology. Those sorts of things, definitely consider those and include those as well. Because again, as Corey mentioned, this is a very product focused mechanism. And so that could be considered as well as the benefit. If you happen to have gone through some sort of I-Corps-like program in the past, I know NSF has a lot of these types of activities. Again, that would be something you would want to mention in your application.
I think there's probably a system where the PI the postdoc PI does not need to be a citizen or permanent resident, but that would mean that their ownership in the company has to be U.S. owned and operated. So I guess it would depend on their ownership in the company. And so I think we saw a few examples. So this has been released one time before. We saw a few examples where the postdoc PI didn't have much of a role in the company other than just kind of being a PI. Oh, you're right. Monique is correcting me that our FOA does state they have to be a citizen or permanent resident. I was giving general SBIR knowledge.
Yeah,
wrote that FOA.
it's worded. It might not. The wording is a little strange in the FOA, but you don't have to be a citizen, but the PI is required to be a permanent resident.
That is true. The general SBIR program and STTR program, that's not true.
Right. Yeah. So there was a question asked about the mentors, a great question. So this is a little bit different than if you're more familiar with our kind of regular SBIR, STTR applications. Mentorship is not a component of those applications. And so here, because the PI is an early stage scientist, there's a big focus by the peer review on mentorship. Ideally, the mentors would stay the same, right, from phase 1 to phase 2. Now, after you're awarded, say something happens 2 years in, the business mentor leaves the company and a new business mentor comes in, that's something that can be worked out and discussed with your program director at that time. But in the application, and certainly the plan should be that you'll retain the same technical mentor and business mentor throughout the award. Let's see, resubmissions. Yes, so there was a question on if resubmissions are allowed for transition grant or for the concept award. Not for the concept award. That's a new proposal each year. Again, if you're considering that, I would highly recommend putting in that white paper that Corey mentioned. It is really short, and that's the best way that you can get feedback on your idea from us and see if it's kind of worth your time putting in that full proposal. The full proposal isn't due until August, so you have plenty of time for that. But I would go ahead and get that white paper in. I think it's May 4th, the deadline's coming up. Now for the transition grant, yes, there is one resubmission allowed. Keep in mind though that the small business transition grant's only issued once a year. So omnibus is 3 times a year. So you have, 3 opportunities. If the original application doesn't go well in January, you can resubmit in April, right? But here for the transition grant, it isn't a full year that you would need to wait to do the resubmission. Let's see. Another question about the PI for the small business transition. Question is the PI going to be under the typical high level of scrutiny as in the regular proposals? So I talked about this a little bit. Again, it's a special study section, so there is consideration that this is an early stage scientist, and think beyond just publications and kind of the normal kind of academic measures of success, if you will, and kind of consider your technology and other measures that can be considered, like I mentioned, pitch competitions or entrepreneurial training, or if you've had some sort of previous business experience or training, that would something you would want to add in your or to either your CV or put somewhere in the application.
Yeah, I think their peer reviewers just want to know they understand, because this is an RFA, it is only, and I think you said this already, right, Monique? It is only small business transition grants in that study section. They're not looking at anything else. It is one peer review panel convened only around these proposals where all of the PIs are junior. So it's not going to be the same as having a junior PI in a normal SBIR STTR study section. And the peer reviewers, because it's an RFA, we give them a little primer on this is the goal of this is who we're trying to support, this is why. So it evens the playing field as far as PI time, PI time and experience.
So there was a question of where to find the grant application. So I believe
the application package, is that the one?
Yeah, I believe I just put it in the chat. Yeah, I believe so. Yeah. Well, I don't know why it's not going out. It's not showing up on my chat box, but on our website, we have a small business transition grant webpage. We have a link to the RFA, so it's right there. You would use that application to address another question asked about the application, yes, you apply for phase 1 and phase 2 at the same time in the same application. Very important, there's a commercialization section that's part of that application. That's 12 pages. And so you definitely want to, if you're more familiar with like a phase 1 SBIR, it's similar to that, or an STTR, but then you would want to take a look at that commercialization section. That's an additional section that's part of a phase 2 and has a very different focus than, say, your research strategy section. And we do have examples on our webpage. Let's see. Let's see if it lets me add it into the chat this time.
We don't have examples of small business transition grant, but we have examples of like fast tracks. So you can look to see like what information goes into what section, but you won't see mentoring plans and these other things that are different from regular SBIR and STTR and are in the small business transition grant.
Yep. So the link I just put in has the sample applications that Corey mentioned, some of the differences. It also has, the funding process, and it has a link there to what's called the SF424, which has a lot of good instructions on the application itself and requirements such as, page length for commercialization and what should be included and different things like that.
There's some good questions coming in.
Mm-hmm.
Want me to start reading them to you? Or are you getting a lot?
So this is a good question, Corey. So STTR grant, does it allow multiple PIs, like one from the small business, one from the institution? You want to take that one?
Yeah, I'll take it. This is going to have multiple answers. So first, the small business transition grant does not allow multiple PIs. So for the small business transition grant, just have a single PI. That's really important. And it's not transferable, so that PI has to stay the same from phase 1 to phase 2. A regular STTR, I love this question because almost every university out there thinks that you have to have a PI for the university and a PI for the company, and that's just not true. Some universities might have that policy, but that's not a requirement for the STTR program. You can do that, but you don't have to. So I guess my answer would be yes, it's allowed. It's not required. You can have one PI for an STTR, and that PI can be employed either by the university or by the small business. Your university might have policies, so you also need to check with them.
And just to add on to that, an important point that sometimes is missed a bit by universities as well is keep in mind, even in an STTR, the award will go to the small business. There's a sub-award to the university, but that's why from NIH perspective and NCI perspective, we're making the award to the small business, to that PI, whether they are at the university or the small business.
Sorry, I just started answering the next question. That just popped up in the Q&A. You can apply if you're affiliated with a not-for-profit health research institution that's not a university. It's rare. We don't see very many of them, but I have made awards to STTR awards to companies that was not a university that they were partnering with. The legislation says not-for-profit research institution, and we say university because that's usually what we see.
Yeah, these are great questions. There's another question about the company and company facilities, and does the company need to have facilities even at the phase 1 stage? So the answer is, at time of application, the company does not need to have physical facilities dedicated just to the company. However, upon award, there's a requirement that it's not a virtual company, so the company should, upon award, have plans for some sort of physical location. So a lot of universities have incubator space, for example, for small businesses that are spun out of the university, where you can rent some, a couple of bench spaces, a couple of offices, that would be allowed. Again, at time of application, you would want to have some sort of letter of support stating you've looked into these options, that there's a space for you, and that upon award, you would be moving into those facilities. But for a lot of our small businesses, particularly things like animal work and et cetera, that's going to be done using university facilities, core facilities, or it's going to be a fee-for-service contract to a contract research organization who's going to do some of those animal experiments at their own facilities.
And I think we have a question. We forgot to mention the NIA program. It's possible that NIA wants us to mention that they have a similar program. It's also a transition award. It's structured a little bit differently. It's not the hybrid. And we absolutely should get some of their slides to put into our slide deck because it's very similar. And they're doing a lot to help encourage sort of entrepreneurship and support entrepreneurship. So that's National Institute on Aging. And so if your technology applies to aging, Alzheimer's, other age-related things, please look at NIA because they do have very similar support.
So, yeah, so I think that's all the questions I see at the moment. If you are interested, I would highly encourage you to reach out to one of the program directors, or you can reach out to me, and I'm happy to discuss with you your project. If you could put together like a draft of your specific aims page. This is a one page where you talk about your project, and you take a shot at writing those different aims, your phase 1 and phase 2 work. Then when we can discuss it and see if it might be a good fit for this mechanism. Definitely, like I said, take a look at the funding announcement as well, and happy to answer questions that come up after you've read through that. The application deadline is in August, so I would encourage you to start doing that early this summer and kind of not wait, but that way you have time to meet with a program director, get feedback, make changes, etc. So thanks, everybody. I think we are at time. And it looks like we've addressed all the questions that have been asked thus far.
Oh, wait, there's one more. If
Okay.
people, they're still coming in.
Oh.
All right, we're at time. I'm going to try to do real quickly these last two questions. I think it's the last two. One, so indirect rates, same indirect rate as the university. Contact your program officer as you're pulling it together. The company can go request up to 40% if they don't have a negotiated indirect rate. The university can use their own indirect rate. But remember, SBIR, STTR budgets are set on total cost, not direct cost. So if the sometimes universities will have a separate indirect rate that they'll use for SB and ST, so it doesn't chip away at what the activities that you can achieve. So talk to your program officer. I think that was it. It's just an important one, so I want to get it in there. All right, thank you, everyone. And thank you, Monique, for answering so many questions. So
Sure, thanks, everybody.
Have a good afternoon.